This is BBC World News. I'm Yalda Hakim. The latest headlines. The Afghan government urges the Taliban to extend a three-day ceasefire in a bid to avoid further bloodshed. After a two-month-long coronavirus closure, the New York Stock Exchange reopens its trading floor. We're speaking to the president in just a moment. And should we all be wearing face masks to curb the spread of the disease? We look at the evidence in today's Coronavirus Explained. Hello and welcome. We're covering all the latest coronavirus developments here in Britain and globally. First, the Afghan government is hoping the Taliban may extend a ceasefire which is due to run out in a few hours from now. The pause in fighting, which coincides with the festival of Eid, is only the second ceasefire of the entire Afghan conflict. It could also herald the release of hundreds of Taliban prisoners. Well, let's go straight to our correspondent in Kabul, Ismail Sadat. Ismail, this was done as a gesture of goodwill. The true test now is, will it extend beyond the 3 days?
Well, as you said, not only the Afghan government, but many Afghans are hoping that the response that the government, with the response of the government to release some 1,000 Taliban prisoners since yesterday and also observe the ceasefire on its side, will encourage the Taliban to extend the ceasefire. It is expiring, by midnight tonight. But the Taliban have welcomed the release of their prisoners by the Afghan government, but they haven't said anything so far whether they will extend the ceasefire or will they go back to the fighting.
The hope is that this ceasefire will not just extend, but it will also lead to the intra-Afghan dialogue, which is what the United States is now hoping. They've struck their peace deal with the Taliban. They're now hoping that they can hand that over to the Afghan government.
That is the hope, and the Afghan government says that the release of these prisoners will, provide the conditions for the start of the intra-Afghan peace dialogue and direct peace talks between the government and the Taliban. But the Taliban, although they welcome the recent gestures by the Afghan government, but they are still insisting on the release of their 5,000 prisoners, which has been stipulated by their deal with the United States. The Afghan government, of course, is insisting that there should be a reduction of violence or a ceasefire, so that the conditions can be provided and an atmosphere of trust can be built for the peace talks and for the release of more prisoners. The recent decree of the president was to release the 2,000 prisoners as a gesture of goodwill after the Taliban announced the ceasefire for the Eid holiday, but they say that the release of more prisoners will depend on the Taliban's response, whether they go back to the fighting or will they continue to hold the ceasefire and to reduce the violence.
Ismail, we'll have to leave it there. Thanks very much for joining us there from Kabul. Now, the floor of the New York Stock Exchange has reopened today for the first time in 2 months since the coronavirus lockdown in New York began. But it's been seen as a controversial move. Aaron's here, as always, to give us the details. Aaron, over to you.
Hey, Yalda, I've said it before, but I, for one, dreadfully miss my daily show where I get to come running out into the studio shouting, that's the bell ringing on Wall Street right now, and that means the US markets are open. Well, the bell did ring, a couple of hours ago for the first time, as you mentioned, in a couple of months. It's important to note that the New York Stock Exchange, Yalda, is really one of the only exchanges that still has flesh and blood, actual traders on the trading floor. Also, as you mentioned, It closed in March after an employee and a trader tested positive. And so this is certainly being seen as a controversial move. Let's head straight over to the floor of the New York Stock Exchange and join the president of that company, Stacey Cunningham. Stacey, a real pleasure having you with us. Let's start with this. Let's start with the COVID-19 picture in the US. Sadly, the US is seeing nearly 100,000 deaths. New daily cases are still hitting around the 18,000 mark. And New York, that wonderful city, has been at the epicenter of this. Why is it safe? Why do you think it's safe to reopen now?
Well, Aaron, first of all, Aaron, thanks for having me on. And I, like you, also get excited about hearing the bell ring at the morning each day. And so this morning, when we had Governor Andrew Cuomo, the governor of New York, here to ring our opening bell, it was an exciting moment for all those traders on the floor. But as you mentioned, we're still living in the middle of a global pandemic. When we made the decision to close the trading floor on March 23rd and move to fully electronic trading, it was based on the conditions that were existing in New York and a growing number of cases across New York City, based on the fact that we did not yet know enough about the virus, about how to protect ourselves. We've taken everything that we've learned over the past couple months. We've worked with public health experts and others, and we put a plan in place so that we can start a slow and cautious reopening with new precautionary measures in place so that we can limit the likelihood of an outbreak on the trading floor, but get back to providing the full level of service that we give to our listed companies and their investors, which means that stocks trade better on the New York Stock Exchange when you incorporate human judgment.
But Stacey, I'm going to be frank here. But you, the New York Stock Exchange, are obviously worried about the amount of legal precautions you've taken. These legal precautions. You've got the people going on the floor signing a waiver. I'm looking at part of it now, and this waiver says that they must acknowledge that returning to the floor could result in them contracting COVID-19, respiratory failure, death, transmitting the virus to family members or others. Some will just suggest, why don't stay electronic for now, at least? Or some are even questioning if this is a publicity stunt. This is about marketing.
No, you're referencing just one piece of the waiver. An important part of that waiver is the fact that the people on the trading floor do not work for the New York Stock Exchange. So we need to make sure that they're committed to following this new norm, wearing masks, enforcing social distancing, so that they can protect others on the trading floor. I've gotten calls and emails every single day from traders on the floor looking to come back to work because they're small businesses who have not been able to earn an income for their families. There's a variety of types of traders on the floor. Some of them are small businesses, some of them are larger businesses. We focused our restart plan on just 25% of the trading floor, heavily skewed toward those small businesses that have not been able to earn an income during this shutdown. And yes, while stocks have continued to trade well over the past 2 months, they haven't traded as well as when you do incorporate that human judgment. And so starting on a path to reopen to a level of normalcy is what today is all about. It's not about returning to normal. It's about living with this global pandemic until there's a vaccine.
Indeed it is. We know President Trump, he's made a lot of political noise about the stock markets. I'm just wondering, just briefly, has there been any pressure from the White House? Have you had any conversations with the White House to get open, to reopen so soon?
I have had no pressure from any government official throughout this period of time. I will say that the government at the city, state, and federal level has been very constructive and supportive throughout this process. They were very supportive in the early days in March in our plans to continue to operate as we were learning new information, very supportive during the shutdown and very supportive during the reopen.
Okay, we know the US Senate, it's passed that bill that could force some Chinese companies to, well, basically stop selling shares, on American stock exchanges. How much, if that goes ahead, how much of a blow is that to your company?
I think what we want to make sure is that one of the things that makes the U.S. capital markets so strong is the way they balance investor protections with investor choice. We do it better than anybody else in the world. Any legislation that we should consider should balance those two things as well. Certainly, transparency is critical, so we have a culture over here very strongly of making sure that investors have transparent information. Any measures to enforce that are very, highly supported by us.
Are you saying some of these Chinese companies that do sell shares in New York haven't been transparent or are not transparent?
No, I'm not. We have the highest listing standards out there, and we enforce those listing standards before we allow a company to list on the New York Stock Exchange. That's standard operating procedure for us.
And just briefly to wrap it up, I mean, staying with President Trump and the tension that's just really increased, certainly since the crisis with China. You being at sort of the epicenter, right, the global financial hub there, are you worried that, you know, an escalation in the trade war will certainly have an impact on companies that trade where you are?
Over time, investors react to news in the market. We'll continue to see that happen as investors are consuming information as it becomes available and reacting to it. I mean, today the market is up over 600 points based on news about multiple vaccines, whether they're conversations about trade wars or conversations about medical improvements that are going to protect us from COVID-19 going forward. You're going to see investors react to that information. That's not new for us. We're used to managing through markets with information changing constantly.
Yeah, and we've certainly seen a lot of that. Stacey, we really appreciate your time. You stay safe and well, and congratulations on getting that bell ringing once again. Stacey Cunningham there, the president of the New York Stock Exchange. And Yalda, let me leave you with this. Just in the past half hour, French President Emmanuel Macron has outlined a plan to support the French auto industry. We know the global auto industry has been hammered over the back of this crisis. I'm just looking at it now. It includes a package of around $9 billion worth of financial support that comes from the government. Also a $700 million investment fund to help the auto sector. And he's also, the French government will incentivize its consumers to buy more electric and autonomous vehicles. All of this as he aims to make France the top producer of clean vehicles in Europe. On that note, I'll say bye-bye.
See you soon, Aaron. Thanks so much.
Thank you.
Stay with us here on BBC World News. Still to come. Just how much do face masks stop the virus from spreading? I've been asking the experts in today's Coronavirus Explained.
Now showing on BBC Real.
Hola, jo soc el Pol.
Jo sóc l'Àngela.
Ara ja fa 15 dies que estem aquí a casa tancats, estem amb la nostra filla de 4 anys.
El pis és petit, però tenim un balcó, llum natural, wifi i un vaixell pirata.
Abans veiem una pel·lícula a la setmana i ara una pel·lícula al dia. Concretament, la Mary Poppins. Estem veient cada dia la Mary Poppins. Cada dia. El mando de distància l'hem d'amagar, el posem molt amunt. Sí que jo tinc la imatge aquesta com del Comecocos per casa, no? En el sentit de que quan un està amb la nena, l'altre aprofita per estar a les xarxes. Jo, per exemple, m'he tancat en el lavabo algunes vegades sense tenir ganes de fer res. O sigui, l'únic que he fet és seure en la tassa, fer scroll i consumir continguts.
Watch more stories like this at bbc.com/real.
I'm here at this hospital where they're already experiencing the benefits of AI.
A new tool to reboot democracy and find common ground amongst the most polarised of views.
This is a very innovative project to protect the environment.
The Take on Tech. Click on BBC World News. Join Alistair Sook.
It's like coming across a nugget of gold.
On an adventure into ancient history.
You're just dazzled by the artistry of the carving.
To show us you don't have to dig.
They could turn the sand into this precious material.
To discover the art in archaeology.
It's spectacular, but it's also blinding.
It bludgeons you as the viewer into submission. It's art that tries, in a weird way, to actually beat you up.
Treasures of Ancient Egypt on BBC World News.
This is BBC World News. I'm Yalda Hakim, the latest headlines. After a 2-month-long coronavirus closure, the New York Stock Exchange reopens its trading floor. The Afghan government urges the Taliban to extend a 3-day ceasefire in a bid to avoid further bloodshed. Today on Coronavirus Explained, we're looking at face masks. What are the benefits or otherwise of wearing them? They've become a major feature of the pandemic, but governments across the world have given conflicting advice. Their use has been made compulsory in more than 50 countries. In others, such as here in the UK and in the US, people are advised to wear them only where social distancing is not possible, such as on public transport. The World Health Organization's official line is that masks should only be worn by people people who are sick and showing symptoms or caring for someone suspected to have coronavirus. They also warned that using a mask alone is not enough and other measures such as hand washing and social distancing should be used. Well, I've been speaking to Dr. Ignazio Maria Viola from Edinburgh University, who has done research on the effectiveness of face masks, and Professor Ben Cowling, epidemiologist at the University of Hong Kong and advisor to the World Health Organization, who explained the two ways the virus is spread. Have a listen.
One is if an infected person breathes, talks, coughs in the direction of someone else who's not infected, then the virus can get from the infected person to the other person through the respiratory droplets that go through the air. The other way is if an infected person contaminates their hands or the environment around them, and then later on someone else comes through the same place, touches the contaminated environment and then infects themselves. So that's the main ways that the virus can spread.
Hence, the emphasis on hand washing.
Yeah, that's right. So the second way, hand washing, will be really important. The first way that I mentioned, hand washing, wouldn't do any good at all because that's directly from one person to another through the air. But for the second way that it spreads, that would be really important. And masks can help for both.
OK, Dr. Viola, I'll come to you in a moment. But first, I just want to show you some of his new research. This is a simulation of a person coughing. Now, you can see air being expelled more than a metre from the mouth. So that's there on our screen. And then this is the same cough with the mannequin wearing a simple mask. You can see how the air is blocked from travelling anywhere near as far. So, Dr. Viola, I'll come to you now. Just tell us a little bit more about your research. So we saw the difference there between wearing a mask and then when you don't wear a mask.
Exactly. What we observe is that if you wear a mask, there is a significant difference. Instead of the air traveling several meters, it only travels several centimeters or tens of centimeters. So there is a significant difference. And that we found is the same for any mask we tested, so including the handmade masks.
So that had to do with coughing, what we just showed there. We'd just like to show audiences now what happens when you simply breathe. So we'll just get that onto the screen as well. So as you can see there, that is just simply from breathing and what happens in the air. So, Dr. Viola, just talk us through that. I mean, a cough, we know that, and we've discussed this a lot about what happens and how much of that remains airborne and travels, but it can simply happen from breathing.
Oh, absolutely. I mean, breathing the air that you exhale from breathing can penetrate several meters as well. What we observe is that masks reduce that one as well. The key thing is that we do not know if coughing or breathing is more dangerous, but it is likely, several research from other authors suggests that it is likely that actually breathing might be even worse because it provides even a larger volume of fluids that is actually exhaled. So you basically continue to breathe and you cough only rarely, unless you know that you are sick, and in that case you probably are already in an environment which doesn't allow you to spread the virus.
So certainly in that case, we saw the effectiveness of when you wear a mask.
Exactly, and masks are extremely effective when you're breathing because masks can really help to decrease the flow velocity that is coming out from the mask. And if the flow velocity is low enough, then simply the air will climb upwards with the thermal plume, because the air around you and the air that you breathe is warmer than the rest of the air, and therefore will actually go up. So will prevent to move farther forward.
Professor Cowling, I'll come to you. I mean, in this instance, whether you breathe or you cough, does it make a difference, though, if you're social distancing?
Yeah, of course. So we know that whether or not you're wearing a mask, you'll have a greater exposure. So if you're infected and you're wearing a mask or you're not wearing a mask, you'll have a greater exposure to the people around you if they're close to you, because any concentration of virus is going to be close, is going to be higher if you're closer. And you can think about someone who's smoking. You can smell the cigarette smoke from a smoker if you stand close to them. You can't smell it if you're further away.
What about if someone's walking past you? It's not that you're in the same space as them, you're just passing by.
Our current understanding of COVID-19 is that people in general are not that contagious when they have the infection. So just a passing contact would be very unlikely to lead to transmission. The transmission events that we've studied, that we know about, often occur with prolonged close contact, often in poorly ventilated areas, in rooms, indoor environments, and so on.
Dr. Viola, different countries have different policies, don't they, when it comes to wearing masks?
Well, that's right, because the answer is very complicated, because our research shows that masks make a big difference, but that's only the fluid mechanics. There are many other considerations to be made. For example, the fact that when you deposit effectively the virus on the mask, and then you can touch the mask, and from the mask you can transfer by physical contact the virus to someone else's or to other surfaces. So there are many considerations that have to be made. And I think also one that is very important is the attitude of people who actually wear the mask, and they might feel a sense of security, which is not correct to have. Therefore,
shouldn't there be a sense of security if you have a mask on?
Because mask will mitigate the problem, but it will not completely suppress it. So the amount of air that you exhaled remain the same, no matter if you have a mask or not. So the only thing that the mask can do is to decrease the flow velocity with which the flow will be ejected from the mask.
And I suppose we continue to be told it's not so much about protecting yourself, it's about protecting others.
Well, the mask works in two completely different ways. They are very, very effective in protecting yourself. We know this. So the masks are actually capable to protect you if you wear a graded mask. For example, the one that are worn in hospital by clinicians. But this is a different aspect of it. Is about if they actually protect you from those who wear them. This is much more difficult to answer.
Professor Cowling, Dr. Viola has just talked about how different countries have different policies because, frankly, the answer is quite complex. But the WHO has made it quite clear, haven't they, that they're not compulsory. And, frankly, you shouldn't be wearing them unless you're showing symptoms.
Well, we know there's a global shortage of face masks in most parts of the world. And so we recognise that healthcare workers have to be the #1 priority. And I think that may factor into the WHO's recommendations. If they were to recommend that everybody in the world wore face masks, I think there'd really be a lot more pressure on hospitals, healthcare facilities in terms of being able to get face masks. So I understand why they're not recommending everybody to wear face masks. But I think if that really is the reason...
Perhaps not the ones that, take the masks away from those on the front line, the healthcare workers. But should they, in your opinion, be suggesting cloth masks or masks that you make at home if they are as effective as we're hearing?
Yeah, I think there's enough evidence now that we can start to talk about the use of cloth face masks, but with multiple layers of fabric, not just a single layer, not just a scarf or a T-shirt over your face. It has to be multiple layers and preferably with a filter in the middle. And I hope that the WHO are going to update their guidance to talk about these kind of masks because I think they really can be useful around the world.
I mean, part of their guidance as well is wear them if you're showing symptoms. But we also know that a lot of people are asymptomatic.
Yeah, that's right. We know that people who are infected can often pass on infection before their own symptoms appear. They can be infectious before their symptoms come. And so that's really one of the reasons why in many parts of the world, everybody's recommended to wear face masks, because then even those people who are infected, don't yet know it, are protecting the people around them by wearing a mask.
Dr. Viola, let's talk about when they don't work. When is it risky to put a mask on?
Yeah, this is an interesting aspect of it, that if you wear a mask, you redirect the air that you exhaled to a different direction. So you are less in control where the air goes. So you might, for example, cough and redirect your air just behind you, and the person behind you will have a false sense of security because you have the mask and you are facing the other way, actually will be invested by the air. So it is actually quite significant, the amount of air that you can be exposed to without knowing it from someone who has a mask.
Also, I suppose, the way in which you take your mask off. So we've also heard in the early days of when people were starting to wear masks that you can almost infect yourself because if you touch your face while you're trying to take your mask off.
This is correct. This is part of the research I think that is needed. It's about, what is the attitude of the people who wear masks and effectively if eventually the mask is providing a mitigation towards the virus transmission. I think this is yet to be verified.
Professor Cowling, what about children?
So in Hong Kong, the children are all going back to school next week and they're all going to wear face masks in school all of the time. It's difficult to get children to wear face masks as well as adults, but it is possible.
I'd like to ask each of you when you choose to wear a mask. Do you wear a mask all the time, or do you choose to wear it when you're indoors? Professor Cowling, I'll begin with you.
Yeah, in Hong Kong, almost everybody's wearing masks outside in public. And I think the most important places to wear masks are in public transport and in very crowded areas. And that's where I wear a face mask.
Is that in general, just briefly, a cultural thing as well in parts of Asia?
I think it's particularly historical because of the impact of SARS going back to 2003 and also the concern about infectious disease epidemics in the past 20 years. So I think there is an aspect of more people wearing masks in Asia, but I don't know if it's just cultural or if it's also historical.
Dr. Viola, just briefly, when do you choose to wear a mask?
I follow the recommendation of the government. I think that this is a difficult call to make. The government has the duty to collect all the evidence, make the recommendation, and I just strictly follow it.
Dr. Viola there and Professor Ben Cowling speaking to me a little earlier. We had some really interesting comments on Twitter about this. Mahesh says, since asymptomatic people are also carriers of COVID-19, masks should be the natural option. But Nahal says it's become a fashion statement and governments across the globe mandating their use is absurd. Well, that's it from me and the team here. Matthew coming up in the next few minutes. See you tomorrow.